progress.
So good evening, everyone. Myself, Dr. Tanima Singhal, and I welcome you all on today's Friday Q&A session. So you can put your questions in the chat box and I'll answer them. First, I will take the questions which are there in the Google form, which all of you have filled. And if you have any questions, please don't unmute yourself, Priya. So let me mute everyone so that we are, okay, so everyone is muted. If you have any questions, put them in the chat box. I'll answer them. So first, I'll start questions with the Q&A with the questions which are there in the Google form, which all of you have filled. So first question is from Vishakha More, low milk supply. So this low milk supply keeps like appearing every time when I take Q&A sessions. I'll answer this after some time. So let me first take the other questions. So first is next question is Rama, cracked nipples and low milk supply. So Rama, if you are having cracked nipples, then first of all, you need to understand that why are you having cracked nipples? Cracked nipples happen if the latching is shallow and the baby is latching only on the nipple. So in this part, you need to make sure the baby is latching deep so that you don't get any cracks on the nipple. And how to make a deep latch, you have to make the baby's mouth wide open so that the baby can take a big bite of the breast and can latch in a way that it is not painful for you and you don't get any cracks on the nipple. Next question is from Archana. My baby is 3 weeks old. He feeds every 30 to 45 minutes during late afternoon to evening, especially. Is that fine? Next, sleeps on my arm and lap, but as soon as he put him in the cradle, he wakes up with eyes wide open. Does it mean I'm having low milk supply? So first of all, Archana, your baby is just 3 weeks old. What happens usually, babies up to 3 months do cluster feeding, especially 3 to 4 hours in 24 hours. So if it is happening, and usually it is around 5:30 to 8:30, and which right now you say late afternoon to evening time, I think it is the same time what you have mentioned. So the babies do cluster feeding. Why do they do that? So that your body knows how much milk to make for them. If the baby doesn't demand regularly, obviously, how will your body understand that the baby needs more milk? So that's why cluster feeding or frequent feeding for 3 to 4 hours in 24 hours up to 3.5 month old baby is perfectly fine. Now, if it is happening like only 3 to 4 hours, it is perfect. If it is happening throughout the day and your baby is going through a growth spurt, and what are the growth spurt phases? 2 weeks, 6 weeks, 3 months, 5 months, 7 months. These times the babies will do cluster feeding like 24 hours, which is also okay. So basically, you need to understand what is the time period they are doing and is it only for 3 to 4 hours? That's perfectly fine. Nothing to worry about. Now, next question you have put that when I put him on the cradle, the baby starts crying or the baby's wide awake. So because when the mother is holding the baby, your baby is just 3 weeks old. The baby gets the warmth and the cozy feeling with the mother. When you put them in the cradle, they feel alone and aloof. So that's why they are doing that way. You need to make sure for few days, just keep the baby close to you. So that, or you can hand over somebody who can hold the baby for some time till they are going into the deep sleep. So this will help you out, Archana. I hope that will answer your question. That answers your question. Next question is from Pratiksha Sharma. Insufficient breast milk. I'll come on that. Aarti. Baby is not taking feed form by nipple. Okay, so I mean think you're asking that baby is not latching directly. So all the mothers who have issues that the baby is not latching, you need to first think about is the baby if you're having enough milk or not. If your milk supply is very low or few drops or like 5-10 ml, then because the babies have got habitual to the bottle flow and bottle milk, good milk flow, that's why they find it difficult on the breast to latch, especially when they are very hungry. Many moms try to put the babies on the breast when they are very hungry. That will not help because they are already very hungry, they are cranky, and they want milk. And when the milk is not there much in the breast, then obviously they find difficult to latch. So in that position, first try to increase your breast milk supply. Also, if you want to do trials, then try once the baby has taken some milk, then you try, or you feed them after they have taken around 80-90% of milk, their regular demands, and then you try. And but you have to do it consistently. Don't do it just 1 or 2 times and you say that the baby is not latching. You need to do it consistently. Also, you need to make sure the bottle which you are using should not be a free flow bottle, because and how you can check, you check, just put the bottle upside down, and if the milk starts flowing by itself, that means it's a free flow bottle. Such the babies who are on this kind of bottles will find it difficult to latch, because they are getting very good flow with the bottle, and that they find difficult to latch with the breast. So if you have to get the babies on the breast along with the bottle feeding, then make sure the bottle should not be a free flow bottle. Next question is from Runal about latching and pain during feeding and nipple soreness. This pain during feeding and nipple soreness is all because of shallow latch. If your baby is latching on the nipple, the baby will find it difficult to latch, and it will be painful for you, and you will also have nipple soreness or cracked nipples. So you need to work on your latching. Follow a deep latch technique which will help your baby to latch properly and in a deep way. Sheetal, latching issues and low breast milk supply. Okay, I'll answer that. Next is Rachita, unable to breastfeed, flat nipples and latching issues. So all of you who have flat nipples or inverted nipples, first of all, you need to understand that there is nothing called as the baby can't latch with flat or inverted nipples. So you have to make sure the baby latches in a proper way on the areola. If the mother has flat nipples or inverted nipples, then you need to make sure you are latching in a proper way, like in a deep latching technique. Like you have to hold the breast in U shape from below and press the breast and get the baby from the opposite side of the opposite hand. And you do need to make sure the baby's head is extended so that the chin touches the breast first and forehead goes back. And then you have to tickle the nipple on the baby's upper lip. When the baby opens a wide mouth, then put them for the breastfeeding. This is the way to latch a baby with the mother who has flat or inverted nipples. You have to latch the babies with areola and not with the nipple in this part. Anyone who has any questions, you can put it in the chat box. I'll answer them, because my these Google form questions are now finished. The most common question, low milk supply, I will answer that. If you have any other questions, you can put it in the chat box. I'll answer it. So now the most common question, like low milk supply, how to resolve that? So first of all, you have to understand, why are you facing low milk supply? Low milk supply will happen only when you are not creating sufficient demand, or you have not created that sufficient demand. Because of that, the supply went down. Now, if you have to revive the supply back, you need to get back to the demand and supply protocols. And how to do that? If your baby is already latching on the breast, but still you have to give formula to the baby, then you need to make sure that you need to create that extra demand for the brain to understand the milk supply. So after every feeding session, just make sure that you are pumping for 5 to 10 minutes for that extra demand for your brain. Now, you will not get milk in this pump if your baby is latching well. So don't worry that you are getting milk or not in the pump after the baby is feeding. So if you are not getting any milk with the pump, it is a good sign that your baby is latching properly. Whiteboard, what is the reason of that? Okay. So anyone who has, I just lost the flow of, so what was I talking? Can you put it in the chat box? What was I talking? Somebody shared the notepad and I just lost the flow. So I was talking about low milk supply. Yeah. So if you're like facing low milk supply, then if you're not creating enough demand, then obviously your brain will not understand how to create the demand. So why to create more supply? How to create more supply? So in order to do that, you need to make sure that you are creating enough demand. So if your baby is already latching, but you are giving formula also, then after every feed session, you need to pump for 5-10 minutes. You might get milk or you might not get milk. That depends on how well the baby has latched. If you're not getting any milk with the pump after the feeding, it's okay, because basically your baby's latch has improved and baby is not getting, you are not getting milk in the pump. And also just imagine, we don't want any milk in the pump after feeding. We want the baby to take all the milk. So why are we pumping? We are pumping on an empty breast to make sure the brain gets enough stimulus to make more milk supply. So that's why you need to pump after your feeding sessions. Now, if your baby is not at all latching on the breast, then how to create the demand? You need to create the demand. Otherwise, how will your brain understand to make milk? So in that case, you need to pump on the breast regularly so that your brain understands the demand and starts making milk supply from that. So this is one part where demand and supply we have talked about. Now, what are the supporting factors? So first is hydration. You have to maintain a very good hydration so your body has enough water to take it as a raw material to make the milk for your baby. Second is you need to make sure that the flow is good. So do oil massage and warm compress on the breast to make sure the flow is good. Next comes the galactogogues. So what galactogogues to take? There are a lot of galactogogues which are available in the market, but you need to make sure that there is no preservative added. If you are using any kind of galactogog or any kind of supplements to increase the milk supply, just make sure, see the backside of it where the ingredients are written. Below the ingredients, you see what are the preservatives added. And most of the times I see preservatives like methyl parabens, propyl parabens, and sodium benzoate are added into that. We don't want any kind of preservatives in your diet. So if you are seeing that there are any kind of preservatives in the supplements which you are using, I don't recommend using them. So you need to make sure that the supplements which you are using should not have any kind of preservatives, because methyl parabens and propyl parabens we don't use in shampoos and creams also. So you need to make sure that the supplements which you are using should not have any kind of preservatives. Now, what supplements you can use which don't have any preservatives or any kind of what you can say chemicals. So what you can go for, what I recommend is lactomagic powder and Morico tablets. These two things are 100% natural with no preservatives, no chemicals. It has around 30 to 35 ingredients which will not only increase the milk supply, it will improve the composition of breast milk and it will also help in the postpartum recovery. Now, next part is keeping the baby skin to skin with you. That helps to release the relaxin hormone in your body, which naturally improves the milk supply. And the last part is tracking. If you're not tracking your progress, how will you know the milestones and how you will know which way you have to go or you are going? So for that, you need to keep a track of baby's weight and baby's formula intake. If as you're working on your milk supply, if the baby's weight is increasing, but baby's formula milk is decreasing, that means you're on the correct path. So just keep following this and keep working on your milk supply. Always remember, just don't lose hope. Always remember, nature is wonderful. Nature will never let your baby not have enough milk from you. So trust your body. If your body can nurture during pregnancy, it can definitely nurture even after delivery. You just need to make sure that you are following the right steps. Just doing random things here and there are not going to help you out. You need to have a customized approach for yourself and a customized protocols. And all of you who are already in our system where you're following the protocols given by us, you just need to trust in the system because we have been in this field for last 16, 17 years. We know exactly what it works. So whatever protocols are given to you, follow them 100%. Just don't leave any stone unturned. Just follow them 100% and have your results discussed with the doctors, with the team, so that you get the best results out of it. Just don't lose hope. Don't think that things are not going to work for you. They're definitely going to work for you. If they have worked for so many mothers, it will definitely work for you also. So just keep following the things, keep yourself motivated, and never lose hope for any kind of things. So that's all from my side. I don't see any new questions in the chat box. I hope that was for today. Okay, girls. So take very good care of yours. And today I am outside my city. So you can see the background. I am at a place, at a different place. But I thought, why to miss my Friday Q&A session? So I hope it was helpful for you all. So take care. Bye-bye. Good night.